Hello everyone, welcome to my YouTube channel, The Ultimate Guide of Human Body. Today we will study about breast cancer. Breast cancer is mainly the neoplastic growth of the breast tissue, which is clinically manifested as palpable lumps, which are painless and solitary. And the treatment is surgical removal of these lumps. These lumps are usually benign, but higher the age of the female, higher are the chances that these lumps turn into malignant carcinomas. Therefore, all breast lumps, irrespective of age of the patient, must be removed surgically. Many risk factors have been identified for the development of breast cancer in women. These are familial history of breast cancer, early menarche, smoking, alcohol consumption, radiation, and some other factors like geographical and racial factors also play an important role. To study the site of breast cancer, here is a diagram. Anatomically, we divide the breast into 4 quadrants and a central portion. So this is the midline, this is the left side and right side. So the inner quadrants are upper inner quadrant, lower inner quadrant, and this is upper outer quadrant, and this is the lower outer quadrant, and the central area is known as central portion. It has been seen that breast cancer more often occurs on the left breast than on the right, and the lesion on the upper outer quadrant occurs in almost 50% cases of the breast cancer. In 4% cases, bilateral involvement of breast has been seen. Carcinoma of breast arises from terminal duct in 90% of the cases, while remaining 10% originates from lobular epithelium. The epithelium of duct undergoes uncontrolled proliferation, which leads to the obliteration of duct with tumor cells. As you can see in the diagram, this is the structure of lobule composed of acini, and this is the terminal duct. So this is the normal epithelium of the duct. When it undergoes uncontrolled proliferation, that is hyperplasia, it results into obliteration of the duct. Now, in case of breast cancers arising from lobular epithelium, the epithelium of the lobules, that is the glands which produce milk, it undergoes hyperplasia, which results into filling of the acini, the ductules, the ducts with tumor cells. For a variable period of time, the tumor cell remain confined within the ducts and lobules before they invade the breast stroma. On the basis of this, the breast carcinoma has been divided into 2 non-invasive and invasive carcinomas. In this video, we will discuss about the non-invasive carcinomas, which are ductal carcinoma, lobular carcinoma, and intraductal papillary carcinoma. First of all, we will discuss about the ductal carcinoma. Ductal carcinoma, also known as intraductal carcinoma, they show ipsilateral spread. The tumor is confined within the mammillary ducts So the terminal ducts are the main site of lesion in case of ductal carcinoma. Now if we talk about the gross morphology, so these tumors are small, about 3 to 5 cm in diameter, poorly defined palpable masses, and a characteristic feature which is seen as nipple discharge. In cut section, we can see the cystically dilated ducts. Now, if we talk about the histological appearance, so there are 4 patterns seen. First is solid, second comedo, third papillary, and fourth cibriform. So in solid pattern, the tumor cells fill the whole of the lumen Second is the comedo. In this pattern, we can see a central area where necrotic debris are present in the ducts, and rest of the area of the lumen is filled with tumor cells. Third pattern, papillary. In this pattern, we see papillary projections in the lumen. Rest of the area is filled with tumor cells. In the fourth pattern, cibriform, we see punched out fenestration in the lumen, and rest of the area is filled with tumor cells. Like this. The next non-invasive carcinoma is the lobular carcinoma. This is mainly the carcinoma of the glands which produce milk. It shows multicentric property. It is non-palpable, shows contralateral spread, and involves the ducts, ductules or acini. So we see this is the site of lesion in case of lobular carcinoma. If we talk about the gross morphology, then these are non-palpable and non-visible tumors. On histological examination, we can see that the ducts are filled with tumor cells which are uniform like this. So this is all about the non-invasive breast carcinoma. The invasive breast carcinoma is discussed in the next video.